We know vitamin D is made. It goes to your liver, converted to 25-hydroxy vitamin D, and then it goes to your kidneys where it gets activated to 125-dihydroxy vitamin D. And we know 125-dihydroxy vitamin D's function is to increase intestinal calcium absorption, remove calcium from the bones when you're not getting enough dietary calcium, and regulating calcium excretion in the kidneys. All makes sense. However, we now recognize that essentially every tissue and cell in your body has a vitamin D receptor. Why would they be there if they weren't having a biologic function? Earliest observation was made by Dr. Suda, 1979. He took leukemic cells that had a vitamin D receptor, incubated them with active vitamin D, and showed that they became normal. That introduced the concept that maybe vitamin D is somehow playing a role in malignancy. And so it turns out that there's a lot of evidence linking vitamin D deficiency and sunlight deficiency with increased risk for deadly cancers. A very nice study by the Garland brothers back in the 90s showed that if you increase your vitamin D intake to at least 1,000 units a day, significantly reduce risk of colorectal cancer. Nice study out of Harvard showed, Nurses' Health Study, that nurses that had the highest blood levels, on average around 48 nanograms per ml, and to get there, you would need to be on about 3,000 to 5,000 units a day for a normal weight woman, right? Reduced risk of breast cancer by almost 50%. Also, a study done out of Nebraska where they took women that had vitamin D sufficiency, 25-hydroxy vitamin D of 30. This is Bob Heaney's group. And he gave them an additional 1,200 milligrams of calcium and 1,100 units of vitamin D, and followed them for 4 years and showed a 60% reduced risk of them developing cancer. So what's the possible connection? Well, you would think it's pretty obvious, right? Active vitamin D can regulate cancer cell growth. So maybe if you increase your vitamin D intake, you can get your kidneys to make more active vitamin D, which will help prevent malignancy. Problem is, your kidneys only make 125-dihydroxy vitamin D for one purpose, to regulate calcium phosphate metabolism and maintenance of good bone health. So no matter how much vitamin D you take, how much sun exposure you have, you will not increase your blood levels of 125-dihydroxy vitamin D. That was a real conundrum, because how is it that all these receptors exist, right? But yet 125D is being produced to regulate calcium metabolism. And so we and others, and Gary Schwartz in collaboration, showed that prostate cells have the capacity to activate vitamin D. In fact, many studies by many investigators have now shown that many cells in your body, brain, skin, colon, all have the capacity to activate vitamin D. We now recognize that what's happening is that when you maintain a healthy blood level of 25-hydroxy D, these cells can convert it to active vitamin D. They regulate gene expression, and then they destroy themselves, right? Because they increase 24-hydroxylase activity. So the 125D is only internally made, acting in an autocrine fashion, will never have an effect on calcium metabolism. It's estimated upwards of 2,000 genes being regulated by your vitamin D status. And so, is there any benefit for COVID pandemic? There's been a lot of information out there on the literature about this, some quite controversial. Well, let's talk about the immune system first, right? What is the effect on the immune system? Inactivated B lymphocytes have no receptor. You activate them and they do. Why? Because 125-dihydroxy vitamin D produced locally at macrophages regulates the production of cytokines in T cells and antibodies in B cells. So vitamin D, through its active form, is regulating both immunoglobulin synthesis and cytokine production. Now, also, we know activated macrophages activate vitamin D. Have you ever wondered why? We now know why. 1849 cod liver oil was effective for TB, right? Vitamin D protects against TB. Why? Adams, Maudlin, and Liu published Science, 2006, a remarkable observation. We know that if you infect the macrophage with any kind of infectious agent, the cell toll-like receptors are turned on. Why? It tells the cell to activate vitamin D. Why? Because active vitamin D goes back into the cell to tell the cell to make defensive proteins, cathalicidin, which specifically kills infectious agents. That's probably why living at higher altitudes or solariums were effective in helping TB patients. We've always known that the flu occurs in the wintertime. And Hope Simpson suggested there's a seasonal stimulus. What might that be? So at the peak flu season is when the blood levels of 25-hydroxy vitamin D are at their lowest. And so a study was done out of Yale. They showed that if you have a blood level of 38 nanograms per ml on average, you reduce risk of upper respiratory tract infections twofold. A very nice study out of Japan showed school children taking 1,200 units of vitamin D a day just during the wintertime reduced risk of influenza A infection by 42%. So is there any evidence that vitamin D can have an effect on your immune system? Well, we asked that question. And so we did a study. We took healthy adults and gave them 2,000 units of vitamin D a day for 3 months. We got their white blood cells before and at the end of the study, and we did whole genome, expression analysis of almost 23,000 genes. All of these blue lines is an individual gene that's underexpressed. All of these orange and red lines are all genes overexpressed. Before, these 291 genes, underexpressed, overexpressed. Just taking 2,000 units of vitamin D a day, all of these genes were turned on and all of these genes were turned off. What were they doing? It turns out that when we looked at these genes and what they do, remarkable. They regulate more than 80 different metabolic processes, DNA repair, apoptosis, oxidative stress, metabolic processes, anti-inflammatory activity. Can you dissociate vitamin D's effect from these other immunologic effects? We wondered about it. So we did a study. And what we did was we looked at PTH levels, which is a measure for calcium metabolism. And we did expression analysis. We gave for 6 months, 600, 4,000, or 10,000 units a day to healthy adults. And as you can see, they're all well matched and they were all vitamin D deficient or insufficient. And we showed very nicely that if you look at the PTH levels for 600 units a day, placebo versus on 600 units a day, hardly anything. Here you can see the 25-hydroxy vitamin D going up on 4,000 units a day and the PTH levels coming down. And for this group, getting 10,000 units a day, dramatic increase in 25-hydroxy vitamin D, and the PTH levels didn't really decrease much lower than on 4,000 units a day. So what now is the effect on gene expression? And so all of these lines are genes. And so you can see all of these blue are turned red, and all of these red are now becoming more blue. Red, blue, blue, red. We showed 162 genes just on 600 units a day were up and down regulated. On 4,000 units a day, look at all that increased number, 320. But what about on 10,000 units, where it doesn't really have any significant additional effect on PTH? Look at all these lines. We're talking about well over 1,000 genes being regulated by being on 10,000 units a day. Here's an interesting observation that was made in India. A dermatologist called Dr. Marwa, who's my good friend and expert in vitamin D in India, and said that he has a child with ichthyosis and rickets and needed to treat the rickets and how best to do that. Well, it turned out that the recommendation in India is 60,000 unit sachet, and they give it once a week for 10 weeks. The dermatologist misheard this. So this is the child before, and the dermatologist gave this child 60,000 units a day for 10 days. So they thought, oh my gracious, this infant's going to be toxic. Well, it turns out instead, the dermatologist calls up Dr. Marwan and tells them, oh my gracious, it's been effective in helping the child. So there may be some benefit to vitamin D. Feed your genes right with vitamin D. So what about COVID? Right? We know that innate immunity and adaptive immunity play a critical role in helping to fight this infection and possibly reducing or possibly exacerbating morbidity and mortality. And it turns out that 125 dihydroxyvitamin D plays a critical role in innate immunity on dendrocyte, macrophages, phagocytes, and as well as adaptive immunity, right, on T and B lymphocytes, as I had mentioned just previously. The cytokine storm is a major issue with this viral infection and is a major cause for morbidity and mortality. And it turns out that 125 dihydroxyvitamin D can down-regulate cytokines that are potentially damaging, that can cause cytokine storm. And they improve cytokines to help fight infection. And we also know that this virus is clever, and it gets in through the ACE2 receptor. And it turns out, curiously, that vitamin D through 125 dihydroxyvitamin D plays a role in the angiotensin renin overall system and may play a role in regulating the receptor as well. So there is some suggestion that maybe improvement in vitamin D status could reduce risk for infection. So all of these are really nice theories, but the question really is this really true? What is the evidence? And so we did a study with Quest Diagnostics, who does millions and millions of measurements for 25-hydroxy-D, and we had an opportunity to take a look at 191,000 plus patients that presented that had COVID positivity. So we knew that they were infected, and we asked the question, at the time of infection, what was their 25-hydroxyvitamin D level, or within a year of that? And we showed very nicely that if you're vitamin D deficient, you have a high risk of acquiring this infection. And the higher your 25-hydroxyvitamin D, lower was your risk. In fact, if you got to around 30 nanograms per ml, it reduced it by 54%. And if you continue to increase your 25-hydroxyvitamin D out to about 55 nanograms per ml, you continue to have benefit. So what about African Americans, especially people of color, are at much higher risk of acquiring this infection? And of that 191,000, we looked at zip codes for where people of color were living. And we showed very nicely, compared to African American and Hispanic, the higher their 25-hydroxyvitamin D, that benefit continued. Lower was their risk of acquiring the infection. Living northern, southern, central, or southern latitude didn't make any difference. Higher your 25-hydroxyvitamin D, lower is your risk. And what about age? Big deal. We know that elders are much more prone to higher risk for morbidity and mortality. Made no difference. Higher the 25-hydroxyvitamin D for all age groups, there was a positive benefit, reducing risk. And also we looked at male versus female, no difference. But now the question is, but will vitamin D improve health outcomes? And so we did an additional study with Dr. Magbouli in Tehran. And what we showed was 235 patients that presented with serious infection, 74% with serious disease. And we looked at severity, consciousness, hypoxia, C-reactive protein, and lymphocyte count. They all were related to vitamin D status. Higher your vitamin D status, lower was morbidity. And we then looked at deaths, and we only saw deaths over the age of 40 and showed 51.5% reduced risk of deaths just by being vitamin D sufficient. 25-hydroxy-D of that magical number above 40 nanograms per ml. So we did get a lot of publicity in Boston, and also the the Herald showed very nicely that 100 years ago, that sun exposure and solariums were used to help fight infections. We also know from this very interesting study looking at latitude and type 1 diabetes risk. And the higher the latitude that you live, higher is your risk for type 2 diabetes. Study done in Finland, infants getting 2,000 units a day, receiving, and followed for 31 years, 88% reduced risk. But the experts came in and they said, you can't give 2,000 units a day to an infant. So they started decreasing the intake of vitamin D. And look at the increased risk of type 1 diabetes in these individuals who had less vitamin D intake during their first year of life. What is the evidence for the beta islet cell? We know they have a vitamin D receptor. 125D will stimulate insulin production. And metabolic syndrome and type 2 diabetes have been associated. National Health Survey showed higher your intake of vitamin D and calcium, adequate calcium intake, lower is your risk. Also, live that magical latitude above 35 degrees for the first 10 years of your life, you have a 100% increased risk of acquiring multiple sclerosis. A study done out of Harvard showed women at the highest intake of vitamin D reduced risk of MS 41%. Iowa study, rheumatoid arthritis, reduced 44%. What about cardiovascular disease? Peripheral vascular disease from the National Health Survey data showed 25-hydroxy-D of greater than 30, 80% reduced risk. What is the mechanism? We know where the 200 genes being regulated, controlling atherosclerotic production, blood pressure control, and cardiomyocyte function. Also, Framingham Heart Study showed if you have a blood level of less than 15 nanograms per ml, 50% higher risk of having a heart attack. What are they thinking about? They are at risk. National Health Survey showed that well over 50 million teens at risk and at much higher risk for hypertension, elevated blood sugar, and metabolic syndrome. We did a study with Dr. Dong down in Georgia and showed that when we gave African American teens 2,000 units a day, they were severely vitamin D deficient, 1-hydroxy-D of 11. Only those that received 2,000 units a day had significant improvement in arterial wall stiffness, right, the prelude to hypertension. And so, what about living longer? Well, it turns out, a nice study from Germany showed higher your 25-hydroxy vitamin D, lower is your risk by about 25%. Does it predict all-cause mortality, cardiovascular mortality, and even from mortality from congestive heart failure? Also, very nice study done by Cedric Garland showed higher your 25-hydroxy vitamin D, lower risk for morbidity, mortality. But what about the vital study, right? What about the studies showing basically no benefit? I think it's worthwhile reading that study carefully. It turns out that 55.1% of those study participants were vitamin D sufficient at the time they started the study. So not a surprise if you give a little bit more vitamin D, it's going to make any difference. And even Dr. Manson said that even though she saw no benefit in reducing risk for cancer, she did recognize 25% statistically significant decrease in cancer mortality. And she recognizes that cancers take a long time to develop. So taking vitamin D for 4 or 5 years may not be enough to really see the benefit. Vitamin D deficiency is a disease of neglect, right? We need it from birth until death. Amount of evidence linking it to these chronic illnesses, right? Think about disease burden and vitamin D deficiency. Pretty significant. Don't think about a normal level, but a healthy level. You want your level to be in a healthy range. And how much vitamin D do you need? Well, how do you know how much you want? I think our hunter-gatherers are giving us a good insight. These Maasai herders, right, who have perfect skin tone for their environment, right, tiny amount of ultraviolet radiation still penetrating through their skin, designed by Mother Nature. Their blood levels by Lex Waldo showed 40 to 50 nanograms per ml, right, that preferred range, right? You would have to take 4,000 to 5,000 units of vitamin D a day to reach that level. Goal, minimum should be 30 nanograms per ml, as recommended by the Endocrine Society practice guidelines. Preferred range 40 to 60 nanograms per ml. And this is shown over and over again, whether for preeclampsia or for mortality or for cesarean section, premature births, and even COVID, morbidity and mortality, and acquiring the infection, all related to that level. How much vitamin D do you need? Well, it turns out, like I said, once you're at around 15 to 20 nanograms per ml, so at around 50 nanomoles per liter, which is equivalent to 20 nanograms per ml, you have to take 100 units to raise it by 1 nanogram per ml or 2.5 nanomoles per liter. Most adults are therefore vitamin D deficient or insufficient, right? And if you take 1,000 units a day, you will not become sufficient. And that's why the Endocrine Society recommends 1,500 to 2,000 units a day. What I recommend to all of my patients, minimum should be 2,000 units a day. Children, 1,000 units a day. Conquer vitamin D deficiency. Best source, back in the 30s, they cleverly marketed Bond bread. If you wanted your kids not to be outside every day naked, vitamin D fortified Bond bread was an alternative. I know that young adults wouldn't be D deficient today if they were still doing this. Back in the 1930s, they were fortifying beer with vitamin D. FDA did not take kindly to this, and so they banned the fortification of beer because they didn't want to have a nutritional benefit of drinking beer in 1937. But I went on eBay and I bought a can. Schlitz Sunshine Vitamin D. Look, Johnny, a spot of sunshine and playing it. 1953, New Yorker. Right? Always have appreciated the beneficial effect of the sun. So I'm a proponent of sensible sun exposure. How do you get the message out to the public? I published a book. I did not want to be controversial. And so I said, I do not advocate tanning. Those that wish to do should do it responsibly. And yes, excessive exposure to sunlight increases risk for non-melanoma skin cancer. But everybody worries about melanoma. Well, it turns out, did you know that most melanomas occur on the least sun-exposed areas? And occupational sun exposure decreases that risk. In fact, there are the data. Lifetime sun exposure associated with a lower risk of malignant melanoma. Ancestors' view of the sun a little bit different than the dermatologist's view. They always recommend sun protection. SPF of 30, properly applied, reduces your ability to make vitamin D in your skin by about 97 to 98%. Have you ever been on rounds with an unenlightened dermatologist? I like the kinder, gentler view in life, and Schultz epitomizes this. And here in the penis character, are you sitting in the sun? I hope so. A little sun is good, as long as we don't overdo it. Perhaps 10 minutes a day. This time of the year is about right. That's what we need, moderation in our recommendation, right? This is what's happened to our sun. It's been demonized for more than 50 years, right? Slip measures in Australia, 40% are now deficient. Who's that? It's an Australian dermatologist on vacation. And guess what? They're vitamin D deficient, right? 87% at the end of the summer. Vitamin D deficiency is associated with schizophrenia, depression, dementia, and Alzheimer's disease. We have a vitamin D receptor in our brain. Our brain can activate vitamin D. And we also know vitamin D, at least in animal studies, can increase serotonin levels, making you feel better. And there's a lot of different consequences for vitamin D deficiency, thinking about central nervous system disorders.